Hi, my name is Leilani Linton Williamson, and this presentation is called The Chemistry Behind Albuterol and Its Impact on the Black Community, created by Daryl Howard, Gabrielle Ford, Leilani Linton Williamson, and Zaria Bulu.
Albuterol is a prescription drug that's used to treat breathing difficulties and various conditions such as asthma, COPD, and bronchitis. For this presentation, of course, we'll be focusing on asthma. And you've probably seen albuterol if you've seen an inhaler before, as it's become the most commonly prescribed medication for asthma worldwide. So albuterol is a beta agonist drug that relaxes airway muscles to improve lung airflow, and it's typically taken through inhalers, tablets, or syrups. It was first introduced in the 1960s as a tablet, but it was later found to be more effective in the form of an inhaler.
Albuterol is a compound that can be easily comprehended in terms of its chemistry. It is an alcohol-based substance which has a physical appearance of a white crystalline powder with a molecular weight of 576.6 grams per mole. The molecular formula of albuterol is expressed as C26H44N2O10S. It is officially identified as tert-butyl aminomethyl 4-hydroxy-M xylene alpha-alpha diol sulfate according to the IUPAC nomenclature. Albuterol can be connected to recent organic chemistry to quartz-related topics such as alkenes, aromatics, and carboxylic acid derivatives. Alkenes, which are carbon-carbon double bonds, can be found within the benzoic ring of the albuterol structure. The aromatic group, consisting of hydrocarbon rings with delocalized pi electrons, is present in the phenyl group, while the carboxylic acid derivative manifests itself as an amine on the right side of the structure bound to a carbonyl carbon. The amine group is also present in the RNHR group on the right side. To further analyze albuterol, infrared spectroscopy can be utilized, where the peaks at 1,120 and 1,150 nm correspond to the benzoic ring and hydroxyl groups respectively. Additionally, it is worth noting that albuterol displays racemic stereochemistry featuring both R-albuterol and S-albuterol configurations at the chiral carbon situated on the right side of the compound.
Medical disparities related to asthma are differences in the prevalence, severity, and outcome of asthma among various populations influenced by factors such as race, ethnicity, socioeconomic status, and access to healthcare. Certain populations, such as Black and Hispanic individuals, those living in poverty, and those with limited healthcare access, are disproportionately affected by asthma and have higher rates of asthma-related hospitalizations, emergency room visits, and mortality. Environmental factors and social determinants of health, such as exposure to air pollution and allergens, poverty, and inadequate access to healthcare, contribute to these disparities. Targeted interventions such as improving access to healthcare, addressing environmental triggers, and addressing social determinants of health are necessary to address these disparities.
So asthma and albuterol in the Black community have a very complex relationship. Asthma is a chronic breathing condition that disproportionately affects Black Americans, specifically Black women, and it's caused by environmental exposures such as air pollution and secondhand smoke, both of which are prevalent in low-income communities mainly composed of Black Americans. These environmental exposures trigger asthma symptoms. Additionally, the chronic stress and discrimination Black women face from sexism and racism cause them to experience chronic stress, which increases the risk of asthma. In accommodation to these disparities, albuterol is incompatible with some Black Americans with conditions such as asthma. Black Americans have genetic differences that affect how the drug is metabolized, and they have genetic differences that increase the risk of asthma. So the genetic variation common in Black Americans that causes them to have a poor response to albuterol is called the ARG/ARG genotype. This complex relationship between asthma and albuterol in the Black community displays a need for holistic and personalized approaches to addressing the asthma cases. However, it is most important to first address the social determinants that create the health disparities to begin with.
Black women are more likely to experience asthma symptoms compared to other ethnic and gender groups. This can be due to factors such as living in highly polluted areas, inadequate insurance, and limited access to specialists. Additionally, social determinants of health like racism, stress, and lack of social support can also impact their asthma outcomes. Targeted interventions are needed to address these disparities, focusing on addressing the underlying causes of asthma inequalities in Black women, including increased access to health care and addressing social determinants of health.
Students involved in the course can relate and apply what they learn about albuterol to how it can be used in the future in fields including pharmacology, pulmonology, allergy/slash immunology, and research on spinal muscular atrophy, specifically pertaining to S&M protein research. In order to combat harmful stereotypes and disparities within the medical profession, it is especially important for Black students to take lead within these professions.
In conclusion, albuterol, also known as tert-butylaminomethyl 4-hydroxy-M-xylene alpha-prime diol sulfate, is a medication that relaxes bronchial smooth muscles to open up airways. It can be taken in various forms, but inhalers have been found to be the most effective. While albuterol can be a useful medication for providing respiratory relief, it is not universal. Black people, especially Black women, cannot always get relief by using albuterol. This is just one of many examples of medical disparities and how the needs of Black people are often disregarded. This is why we need more representation in the medical field. Black pharmacists, pulmonologists, and allergist-immunologists can play a significant role in formulating and distributing a medication that will provide respiratory relief for Black people.
Thank you for joining us in our discussion of how the chemistry of albuterol disproportionately affects Black women. Attached here are our references in APA format, and thank you for listening.